sense of the genetic pathways, the biochemical pathways that cell finds that it's most comfortable with. Those are the pathways that make that cell what it is and are intrinsic to the properties and behaviors of that cell type. Those same rules then come into play when that cell becomes malignant, because that cell is still dependent on the very genes and pathways that made it a normal endocrine cell to begin with. So if we can understand what it is that makes that cell unique, that makes that cell produce hormones and respond to its environment, then we will be in a much better position to use targeted treatments as opposed to generic treatments. The successes, or the very prominent successes in cancer treatment, have come almost exclusively in instances where there has been a more detailed understanding of the genes and pathways that make cells what they are. More importantly, it also comes from understanding what particular mutations and changes occur in particular tumor types so that they can become malignant. And it is with the confluence of that knowledge, of the rules that make a cell what it is, the understanding of the genes and biochemical pathways that contribute to a cell's normal behavior, and the mutations that particular cells accumulate en route to becoming tumors. The confluence of those three bases of understanding are what will ultimately result in targeted, successful treatment of tumors like carcinoid tumor, and that is the basis for much of what we do in the research laboratory and the kinds of advances that we hope and expect to bring into the clinic in the foreseeable future.
My name is Matt Koch. I'm a medical oncologist here at Dana-Farber Cancer Institute. And my interest over the past 10 years has been not only treating patients with carcinoid tumors, but also discovering novel therapies and investigating ways in which to improve the treatment of patients with carcinoid tumors, which historically has really been fairly limited. I think patients with neuroendocrine tumors actually do have a number of treatment options. There are a number of standard options for patients. These include treatment with somatostatin analogs like octreotide or lanreotide. Treatment with alpha interferon can also be beneficial, as can certain types of surgery and even a procedure called embolization of metastases to the liver. So these are all treatments that are available to patients outside of a study setting. At the same time, at least right now, many of the newer agents, and particularly many of the targeted agents, are available only in clinical trial settings or investigational settings. So from a patient perspective, it can be very beneficial to consider clinical trials as a means of getting access to some of these new promising drugs. The truth is, we don't know yet whether all of these new targeted agents are in fact going to be proven successful in treating carcinoid patients, even though we're quite excited about it. There are very large trials right now going on for the very first time to demonstrate, hopefully, efficacy of some of these new targeted agents. If that happens, many of these new treatments will become commercially available and easily available to patients with carcinoid and other neuroendocrine tumors. So it's been really actually a fascinating history and fascinating story over the past 10 years. When I first started treating patients with carcinoid tumors, it was really a backwater of medical treatment and medical research. All we really had at that time were some of the very standard chemotherapy treatments, and many of the standard chemotherapy treatments have really have not been terribly successful in treating patients with carcinoid tumors. What's happened over the past several years is that there's really been a revolution, not only in cancer care in general, but also in the treatment of patients for carcinoid. And that revolution has really come from the development of some of these novel targeted therapies. What's been perhaps most fascinating is that many of these targeted therapies are not necessarily particularly active in many of the more common cancers, but seem to have some unique activity, particularly in patients with carcinoid tumors.
Hello, I'm Dr. Andrew Leiter at the Division of Gastroenterology at the University of Massachusetts Medical School in Worcester, Massachusetts. Today I'm going to tell you a little bit about some of the major research developments towards understanding carcinoid tumors, endocrine tumors of the gastrointestinal tract. First of all, this is a field that I would say has both modest advances with many remaining challenges still ahead. The good news is that earlier diagnosis in time to surgically cure carcinoid tumors in some parts of the GI tract, like the stomach and large intestine, have gotten better due to advances in endoscopy and routine screening for colorectal cancer by colonoscopy. Furthermore, there's been considerable improvements in the imaging of carcinoid tumors, resulting in earlier diagnosis. Finally, there have been some promising but very preliminary results suggesting that somatostatin receptor targeted radiotherapy has some promise for significantly prolonging the course and quality of life in patients who have advanced carcinoid disease that is otherwise incurable. The challenges, however, are many. There's an increasing incidence in the lung, colon, and other gastrointestinal sites that's not well understood now. Furthermore, there's relatively little progress in making an early diagnosis and the treatment of small intestinal carcinoids, which are often associated with the sickest of patients. In addition, diagnosis continues to be delayed for many years in many of the cases. Symptoms are frequently attributed to other common benign diseases. Tumors are usually surgically incurable by the time of diagnosis. There is no highly effective chemotherapy for disseminated disease that cannot be cured by surgery. Finally, there's relatively little understanding of the biology of the cells in the GI tract that give rise to carcinoids, and that may slow the discovery of new and novel biological therapies. There have been some important developments in understanding and research on carcinoid tumors in the last year. I'd like to tell you a little bit about a neuroendocrine tumor carcinoid summit conference that was held at the National Institutes of Health in September 2007 under the auspices of the National Cancer Institute. The NCI invited an expert panel of basic scientists and clinical researchers to review the current status of clinical and basic research in the field. The conference consisted of presentations by the invited panel, breakout sessions to assess specific aspects, and the production of the panel's conclusions, the presentation of the panel's conclusions and recommendations to the NCI. The conclusions and recommendations of the panel were as follows, and they focused on 4 areas: diagnosis and management, identification of novel therapeutic strategies, understanding neuroendocrine cell biology, and the integration of clinical strategy. The conclusions were that there is relatively little solid information to address each of the major themes, and that additional research funding was sorely needed. The progress in treating many types of carcinoids has been disappointing. This slide here just illustrates the overall 5-year survival in patients with carcinoid tumors from several different GI sites over a 20-year period, showing relatively little improvement over a long period of time. These results are disappointing and point the need for more research. Also, we don't really understand it, but for reasons not known, there's an increasing incidence, quite dramatic in fact, for several types of carcinoid tumors, in particular ones of the lung and bronchial tree, the small intestine, and the rectum.